This is another outbreak. We see these intermittently. If we were vaccinated, would this be a problem?
Morning, Laura. Look, we do need to remember that we're in the early phases of the vaccine rollout, but it's definitely disappointing that we haven't gotten all of those frontline workers vaccinated as yet. And had that been the case, there would be a reduced chance of these outbreaks still going on. We do have, of course, the requirement to protect the workers with personal protective equipment and appropriate airflows and so on. And unfortunately, the hotel quarantine system is continuing to fail in these rare occasions, but the vaccines, I guess, are the next backstop, and we need to get on with vaccinating all those workers.
The hotel guard in Sydney had one shot of the vaccine. He hadn't quite got around to getting the second one yet. What happened there? Does this show that you are not, well, the one shot isn't as effective as we thought it might be?
No, it doesn't at this stage, because we understand that his exposure was potentially only a few days after he received his first dose of that vaccine. And that's not enough time to mount a significant immune response and to guarantee any level of immunity. We do understand that the Pfizer vaccine has quite substantial immunity after a single dose, but not after only 3 or 4 days after the vaccine.
Okay, so let's get to the vaccine as we've been talking about these. Do we need to remind people once again that a vaccine doesn't actually stop you from getting COVID, but it does reduce the symptoms, and that's the most important thing?
Yeah, on a population basis, what we're aiming for here is to stop people getting really, really sick, to stop people ending up in hospital, and to stop people dying from COVID. And that's what we've seen throughout the world. All of these vaccines have been shown to be extraordinarily effective at reducing that severe illness, and that's the main point of this vaccination program. Around hotel quarantine, though, and our healthcare workers, we are hoping that these vaccines will provide some block to catching the virus and to transmit it to other people, but we just don't have the data as yet as to how effective they are at that, and that's why all these other measures, the borders, the PPE, these are still required even once we start to get the vaccination rolled out.
Okay, so on the spread, and let's just repeat again, getting the vaccine doesn't necessarily show quite yet. We don't have the data that it stops transmission 100%?
That's right. So it depends on the strain of the virus as well. What the vaccines have been shown to be super effective at preventing severe disease, but less effective at preventing people testing positive or getting a very mild version of the symptoms. They're still good, but they haven't yet been proven to do that. That's why herd immunity is not the aim of this project, of this vaccination program. The aim is to stop people getting very sick from COVID.